Today we are discussing about enemas. First we will discuss definition, then purpose of enemas, then classification of enema, then what are the equipments we needed or articles we needed that. Then we will discuss about purpose. So first we are discussing about definition. What is definition? So enemas will introduced into the lower bowel through the rectum for the purpose of cleaning or to the introduction of medications and relieve the constipation. So why we are introducing enemas means for the purpose of cleaning or to introduce the medications. So why we are introducing medications means so it will relieve the infection or inflammation and it will also relieve the constipation in severe cases. So enemas will introduce and it will reduce the constipation. So now we will discuss about purpose. So main first one, it will reduce the constipation. Enemas will reduce the constipation. It will lubricate and soften the stool. It reduces the constipation and to treat the infection or inflammation. In medicated enema, so any infection or inflammation it causing means in colon infection or inflammation is having means it will reduce the infection or inflammation and to soften the hard fecal matter. So if in this evacuant enema, so if we are introducing or we are introducing means it will lubricate the hard fecal matter, then it will soften the constipation, then it will relieve the gaseous distension. So enemas will decrease the gaseous distension in the intestine. Then to induce the free bowel movements, it will to induce free bowel movements means it will contract. Enemas we are introducing means it will actively contracts, then bowel movements will actively contracts means constipation will relieve. Then to reduce the pain. So if any colon infection or inflammation is there means we are introducing enemas means it will reduce the pain and it will relieve the temporary pain also. In medicated evacuant enema, there are classified into 5 types: oil enema, purgative enema, astringent enema, then anthelmintic enema and carminative enema. So oil enema will given to relieve the hot constipation. It acts as a soften and lubricate the hard fecal matter. In the case of severe constipation, oil enemas will administer. Purgative enema, it acts as a actively contractions of the bowel movements and it relieves the constipation. So astringent enema, you will check the any infection or inflammation in the colon and it acts as a temporary relief of the pain. So then carminative enema, it acts as a, so it will administer for the purpose of, so it relieves the gaseous distension in the lower bowel. Then anthelmintic enema will administer for the purpose of, it will destroy the worms in the lower bowel. So in the evacuant enema, third classification, cold enema. Cold enema will administer or introduce for the purpose of hyperpyresia patient. It will reduce the body temperature in the patients. There are classified into 4 types: stimulant enema, nutrient enema, anesthetic enema, sedative enema. So what is stimulant enema? In stimulant enema, so for the purpose of any poisoning patients or any shock patient, it will administer for the patients. Then nutrient enema will administer for the balance of fluid and food in the patient. So if any unconscious patients, nutrient enema will administer. Then anesthetic enema, it will relieve the temporary pain in the patients. Then sedative enema, it will induce the sleep in the patients. So now we will discuss about the equipments. What are the articles we needed while during the enema procedure? So disposable gloves, then lubricants, then Macintosh, bath blanket, tissues, toilet tissues or bed pan, IV stand, enema fluid, then pre-pricked enema container with rectal tube. So these are the equipments we needed for the procedure. Now we will discuss about the procedure. So now we will discuss about the procedure. First, explain the procedure to the patient. First, we have to explain the what procedure we are doing, that we have to explain to the client or patient. Then assist proper position. So we have to give the comfort position to the patient. Then provide privacy to the patient. So we have to close the curtains and windows for the privacy to the patient. Then wash hands and apply the gloves. So first we have to wash our hands and we have to put the gloves. So then rise bed to the appropriate height. So our comfort position. So we have to raise the bed for our appropriate height. Then remove the clothing and cover the patient with the bath blanket. So we have to remove the patient clothes and then we have to cover the blanket for the patients. Then give left lateral position to the patient. So for the enemas we have to give left lateral position to the patients. So then place the Macintosh under the hip. So we have to place the Macintosh under the hip, then expose the rectal area. So we are administering the enemas in rectum. No? So that's why we have to expose the rectal area. Then place the bedpan if needed. So if bedpan is needed means we have to place the bedpan. Then so administer enema to the IV stand. Attach all tubings. Fill the desired enema solution. So according to the patient need, we have to administer the enema solution. So then remove the air from the tubing. So we have to remove air gaps from the tubing and lubricate the rectal tube. So how much we are inserting the enema tube, so that much we have to lubricate the tube. So then we have to lubricate 7 to 10 centimeter rectal tube. Then insert the tubing into the rectum. So then we have to insert 7 to 10 centimeters to the rectum. Then release the stopper and allow the fluid to run into the rectum. So we have to allow the stopper. We have to on the stopper. It will flow to the rectum. Then monitor the flow rate and adjust according to the patient tolerance. So according to the patient's tolerance, we have to administer the fluid to the rectum. Then ask the patient to take deep breath. So it facilitates the flow into the rectum. So we have to advise the patient to take deep breath. So patient is taking deep breath means it will increase the flow rate. Okay. Then clamp tubing after the all fluid installed. So after fluid installation, we have to stop the stopper. So after the procedure, we have to place the tissues under the hip. So we have to place the layer of tissues around the tube at the anus and gently pull it out the rectal area. So after the procedure, what we have to do, place the toilet tissues under the hip or anus and gently pull out the rectal tube. So then we have to remove the rectal tube. Then advise the patient to hold the fluid inside for few minutes. So we have to advise the patient to hold the fluid for a few minutes. Then discard the enema tubing into the container. So after the procedure, we have to discard the rectal tubing in the dustbin or the container. Then assist the patient to bathroom or bedpan. If patient has to go bathroom, he can able to walk means we have to take him for the bathroom, or if patient cannot walk means we have to administer the bedpan for the patient. So then we have to record the type of enema we administer, then what time we given enema, that we have to record, and after the procedure we have to monitor the patient condition, so better or not, so we have to monitor that.